marching on to the beat I drum. I'm asking to be seen. I make no apologies. This is me.
Hello, good evening. Thank you all for being here tonight. Today I'm here representing Psyflo, a company dedicated to improving mental health for students across the country. Now, in working towards that goal, we've talked to hundreds of people about their experiences with mental health. But there's one story that we always come back to. It's the story of a young woman from Kansas City, Missouri. Let's just call her Dee. Now, Dee was bright and outgoing, but she had a rough childhood. At 8 years old, she experienced homelessness for the first time. At 13, she witnessed the murder of a family member. At 18, she was assaulted. It's fair to say that Dee had her fair share of mental health challenges. And every day she went to school hoping that someone would see her and help. But her school simply didn't have the resources. The single counselor for over 2,000 students was overwhelmed and under-resourced, so a system intended to catch her at critical moments allowed her to slip through the cracks. Dee went on to be in and out of treatment for over 10 years. She had 7 different therapists, 4 psychiatrists, 3 inpatient hospitalizations, and over $100,000 worth of medical debt. Now, at Psyflo, we couldn't help but wonder, what if Dee's school could have helped her sooner? What might that journey have been? At Psyflo, we feel pretty confident that Dee's story could have been dramatically different. And that's because Dee's story isn't just hypothetical. Dee's story is my story. My name is Dee Oliver, and I'm the CEO and co-founder of Psyflo, where we create the tools that schools need to deliver mental health support to each and every student. Now, you heard a little bit about my story, but the truth is, it's not the exception, it's the pattern. You see, this isn't about one girl in Missouri, but one student in every row of every classroom in this country. 1 in 5 children have a mental health condition, and suicide is now the second leading cause of death among teens. And with over 20 million students needing mental health support, schools simply cannot support them. They don't have the technology, they don't have the staff, and they don't have the time. But see, this crisis is so bad that organizations like CMS, the Centers for Medicaid and Medicare Services, are now creating opportunities for schools to get funding. Now, schools are leaving $45 billion worth of insurance reimbursements on the table because they don't have the technology and the staffing to deliver the support. That's why we created Psyflo, the AI infrastructure for school-based mental health. We provide schools with the technology and the staff they need to deliver mental health support and capture reimbursement. What does that look like in practice? Well, first, students have access to an AI-driven platform. It has things like mood check-ins, wellness checks, but most importantly, a chatbot that detects signs of risk. It can detect whether a student is exhibiting signs of self-harm, harm to others, or signs of neglect and abuse. It signals to counselors and social workers within schools when a student needs help, but most importantly, allows them to refer a student to licensed mental health professionals who can deliver telehealth sessions and bill all through our platform. So how do we make money? Well, our business model activates multiple revenue streams. First, we charge schools a per student per year licensing fee, but then we tap into public and private payers, taking an administrative fee for every claim that's processed through our platform. And we're targeting a massive market, nearly $20 billion, and if we capture just 3%, we're looking at $350 million SOM. Our go-to-market strategy focuses on those states that have already adopted this CMS guidance, namely 25. We already have pilot locations in 2 of them, and that's only growing. Our traction speaks for itself. A few months ago, we got our first paying customer. Thank you. A few weeks ago, we onboarded 3 schools, and now we have nearly 30 schools in our pipeline to start this spring. You see, whereas most school-based mental health solutions are focused on prevention, identification, intervention, or billing, we are focused on all 4. We're creating an integrated, unified system to ensure that no student falls through the cracks, like I did. Now, you heard the beginning of my story, but it didn't end there. I went on to earn 4 degrees spanning public health, health technology, machine learning, and AI at top universities like NYU and Cornell. I bring that experience, thank you, I bring that experience to my team. However, I'm joined by exceptional individuals with experience from Johns Hopkins University, Santander, Y Combinator, and Snapchat. Together, we're building a system of support that every student deserves. And we've raised over $150,000 to date from organizations like NYU, Cornell, and Build in Tulsa. Today, we are looking for your support as we raise $1.2 million to bring this to life. Thank you very much.